If you are a busy professional woman and you suspect you have high cortisol, today I'm giving you 10 signs that can tell you if this is true. And then, of course, in another video, we're going to talk about what we can actually do about it to fix those high cortisol levels.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
All right, welcome back to the She's Healthy podcast. If this is your first time here, my name is Lori Aikman. I am a nurse practitioner. I'm the founder and CEO of Crown Executive Health, where we help busy professional women regain and sustain their energy so that they can enjoy the success they've worked so hard for without burning out. And we do that through comprehensive hormone management and a functional medicine approach. So today on the podcast, we're talking high cortisol. What are signs of it? What's really going on there? And then, of course, we're going to talk about what we can do about it. But before we dive in, I've got to give you my medical disclaimer. I am a nurse practitioner, but this podcast is for informational purposes only. I do recommend, take and learn. That's the whole point of this podcast, is to bring education to help women understand their bodies. But of course, you need to consult your provider, your practitioner, before you make any changes to your health plan. All right, let's dive in. So today I'm giving you 10 signs. And if this is your first time on the podcast, I really try to keep these episodes like 20, max of 30 minutes. So I'm going to move through pretty quickly here. So number one, just diving in. So let me say first. So if we talk about high cortisol, when do we have high cortisol? So cortisol is our stress hormone, and cortisol gets dumped into our bloodstream in response to stress. So something called fight or flight. So when that fight or flight response is triggered, we get a lot of cortisol, and then we're going to talk about how that shows up in the body. So and I will tell you, it's a little nuanced. So each person can respond a little differently. So, you might hear people say, well, when I'm stressed out, I'm not hungry at all. Or when I'm stressed out, I want to eat a lot. So these aren't like hard and fast. Of course, it's going to depend on the type of stress, your history. If you have a history of trauma, your response to stress is going to be different than somebody else's. But one thing can happen is that you can have a decreased appetite so that's our number one, when you have high cortisol levels. And the reason being is that cortisol causes your body to release stored sugar to increase your blood sugar levels. And the reason we have to think about fight or flight as a protective response of your body. So your body is trying to protect itself. You've got something that is triggering your body to respond, and your body's trying to go, okay, how do I get out of this situation? Or how do I, fight through this situation? So your body is going to dump sugar into the bloodstream to give you energy to respond to the situation. So for some people, you may not feel hungry because of that. And there's some other things that could be going on contributing to that. We'll talk about like some stomach stuff. But then the reverse of that, some people can really feel an increase in cravings when they are having high cortisol levels. And reason being is that high cortisol, one, it does have that increase in blood sugar, but then our body releases something called insulin. You've probably heard of insulin before. Insulin is a hormone that helps the blood sugar get into the cells. Okay. So if you have an increase in blood sugar and then increase in insulin, sometimes that blood sugar can then come down. And when that blood sugar drops, a lot of times people feel like that fatigue come on. Oh my gosh, I need to eat something. I need some caffeine. I need my afternoon coffee, things like that. So you can experience cravings from that drop in blood sugar. You can also experience cravings because stress affects some of your brain chemicals. Specifically, one of them that can affect is your dopamine levels. And so you can feel like, I want to feel better. Not necessarily, if the craving is coming from not necessarily the blood sugar standpoint, but from that brain chemical standpoint, you might feel like, well, when I eat this, I've had this definitely my years of working in the hospital. we've had a stressful day. I just want to eat. I want some chocolate, right? That's going to make me feel better because of those pleasure chemicals that are getting released from eating that. Okay. All right. So, number three, we can experience abdominal weight gain with high stress. You might have heard of this. I've seen stuff on the internet about this. Like, do you have a cortisol belly? And what's really going on if we think about, we just talked about blood sugar and insulin, going up. And when we have high blood sugar, when we have higher than optimal insulin levels, insulin is a fat storing hormone. So we might start storing hormone, and it specifically happens around the belly. It can happen in some people you might have heard this called visceral fat. Um, so it's, again, our body, we have to think of how our body reacts a lot of times as primitive responses. Our body wants to protect itself. And so your body is going to then take that extra blood sugar and store it with the insulin as fat so that your body has nutrients later. So if it gets into a place where it needs to release stored sugar again, it has it packed away, if that makes sense. So, number four, we can have digestive issues. So when we're under acute stress, and I'm going to try not to get on too much of a soapbox here. When we're under like initial acute stress, cortisol is high. We have a release of stomach acid release of acid into the stomach. So we can have digestive issues like acid reflux, heartburn, things like that. So you see all the antacids. How many people, I don't know how many patients that I come across that are on an antacid, on Pepsid or omeprazole, Prilosec, OTC. What we have to I just want it for a second. So when stress continues, we can actually have lower stomach acid levels. So those PPIs, the Prilosec, the omeprazole, the Tums, the antacids may actually not work as well because stress has gone on and we actually have lower stomach acid now instead of high stomach acid. But initially we do have high stomach acid levels. So again, you can feel that heartburn, that maybe reflux. You can also maybe have basically we have to think about fight or flight, the opposite of that. So there's two sides of the autonomic nervous system. We have fight or flight. And then I remember learning it in biology class years ago. The other one is called rest and digest. So when we're in a calm state, our body can rest. We can digest our food well. But when we're in that fight or flight state, our body's not worrying about digestion because it's worrying about how to respond to the stressful situation. So overall, your digestion can be off. You can have, maybe you have diarrhea. You have, that increase in stomach acid. It makes you, things move through you really quickly. Like some people might say they have like nervous poops. That's what's going on there. You can just various digestive issues because again, your body is not focused on digestion. That's like a lower priority for it. It's really focused on, okay, let's get sugar to our cells, to our muscles so we can respond and go from there. Okay. So then number five, feeling wired. So let's talk about, okay, cortisol is high. Some people can actually feel kind of like, you can feel wired in a good way. Like I have all this energy. I'm like, okay, I got to get all this stuff done. You're feeling very energized maybe from cortisol being high. But you can also feel, I know for me, I felt kind of wired, like where I feel almost like an internal buzz when this has happened, like this, but I can't focus. I'm like going, okay, I have a million things I need to do before I leave for work today. I got to get the kids ready. If that makes sense, you can feel this. It's not necessarily wired and focused and wired and clear. It can be wired and like, I'm going to do all the things at one time and I can't focus. And, we're going to talk about how cortisol actually affects our brain and that can be a problem too. But again, just feeling wired. And then because of that, number 6, we can have trouble sleeping. Just bump my mic. So we can have trouble sleeping. So when cortisol is high, what happens is cortisol and melatonin, have an inverse relationship. So when cortisol goes up, melatonin is going to go down. So some of you that might, like, you wake up in the middle of the night and maybe you feel kind of anxious, you have racing thoughts. Maybe you have a hard time winding down at night. And because you're just like, your mind is racing, you're thinking of all the things. That can be a sign of high cortisol because your body, again, is in fight or flight. It's not able to switch as easily into that rest and digest and allow you to sleep. And that can be hormonally because that cortisol is coming up and that melatonin is getting pushed down. Okay. All right. So that was number 6. Number 7, then related to that, you can have palpitations or feeling like your heart is racing. So I hear that a lot. I've heard that a lot over the years from patients when they're like, oh yeah, I had palpitations, but it was related to my anxiety. And what's happening in that situation is, this high cortisol is happening. Fight or flight is getting triggered. There What's happening is, fear is getting triggered. A lot of times when fight or flight happens, there's an element of fear happening, like, oh, what's going to happen? How do I respond to this situation? And so people can feel anxious. And then related to that, we can have physical manifestations like we're talking about today in our body, but we can feel like our heart rate and our blood pressure are high. I know my husband has talked about this, where when he's maybe he's working nights, they have off hours at work. His blood sugar his blood pressure will be a little higher, and he says he can kind of feel it in his body. And that is so cortisol is being released, but not only is cortisol released, we have all these other chemicals that are released in our body. 2 of them in particular are epinephrine and norepinephrine, or adrenaline and noradrenaline. And so you've just got to think about those. Those are chemicals that are increasing our heart rate and our blood pressure. And so we may feel, again, palpitations, like our heart's racing, maybe even a little short of breath. A lot of times when people's heart beats really fast, they feel short of breath because their blood isn't getting as much oxygen because it's moving through really fast. Okay. All right. So that was, I have switched the order on some of these. So 6, 7, 8. Number 8 is you can have, period irregularities. If you're a woman that's still cycling, you haven't gone through menopause, you haven't had a hysterectomy, you might be having issues with your period. So what happens is, again, when we have fluctuations in cortisol, that can drive down our sex hormone. So we can have lower estrogen, lower progesterone. And so we can sometimes skip a period. We can also just have an off period. I see a lot of times where when I'm doing functional testing with my clients, they have low progesterone levels. And why they have low progesterone levels is because they haven't ovulated. And a lot of times they haven't ovulated because of these cortisol issues. So that the stress response, fight or flight, is triggering cortisol. Cortisol is causing you to not ovulate. And so you have low progesterone levels. So this can be, again, we can skip periods. We can have normally my cycle's 30 days and this time it was 21, or this time it went 45. You can have some variation in length. If it is blocking ovulation, so you have low progesterone, but you still have your estrogen, you can have a really heavy period. You can have a heavier period, longer period, spotting in between your periods, things like that can affect it. And if it's lowering both estrogen and progesterone, would be when you actually skip that period and you don't bleed. So it can show up a little differently how it's affecting your body, but in general, changes in your period can be driven by, stress, the high cortisol levels. Okay, 2 more to go. I think we're doing okay on time. 14 minutes. Okay. So we can have memory issues and what they call decreased executive function. So this is kind of like what I was talking about, when you feel wired but you can't focus. When we have, and part of this is just because how cortisol affects the brain. So initially under stress, when there's a little bit of stress, there's actually a great video on this. I'll have to find it's on YouTube somewhere. I think it's somebody's TED Talk where it talks about a little bit of stress actually causes us to okay, how am I going to deal with this? I'm going to rise to the occasion. I'm going to get things done that I need to. Um, but what I find is a lot of times, especially if you're a professional woman and you're like raising children, or maybe you're taking care of elderly parents, you're kind of you know, you're juggling everything. You've got responsibilities not only in your personal life but your professional life. When you've got all that going on, you stress essentially gets to the point where it's too much to handle. And when we pass that point, cortisol actually affects the brain differently. And it can be, we don't have that necessarily okay, I'm focused, I'm gonna get stuff done. We can have more the issues with memory, and issues with focus. You could call this brain fog, right? I don't know, I just can't focus. And this is partly because of cortisol's effect on the brain. And I'm not going to get into too much detail, but basically cortisol will then affect our neurotransmitters. Those are our brain chemicals, which then affects our focus. So I will say this might be a little controversial. I wonder how much, because I see this cortisol issue in so many women, literally 99% of the women that I've worked with over the past few years now have had dysregulated cortisol. And I just look at, okay, how many people out there are now, I'm pretty sure I have ADHD. I need medication. I wonder how much is it really ADHD and how much is it issues with cortisol because of the culture that we live in. And we never let ourselves rest, or we never get rest. And we're always, fight or flight is constantly being triggered, which then affects our memory, affects our executive functioning. So that's just something to think of if you've thought, well, because I've encountered women who are like, well, I think I have ADHD, but the medication didn't help. And what do we really, it's hard to know what the real answer is there. Maybe just depending on who you've worked with and what kind of testing you've had done, but just something to consider if you have struggled with focus and attention and things like that. All right. And our final one is a big one. So number 10 is you can have symptoms of hypothyroidism. Okay. So what happens is when we have high cortisol, when our stress response is triggered, it actually affects the conversion of our thyroid hormones. So quick anatomy lesson. Our brain, the pituitary, signals to our thyroid that TSH. And so then your thyroid makes T3, or excuse me, your thyroid makes T4, and then T4 has to be converted to T3 in your body. And T3 is the active thyroid hormone that impacts the cells, that has the thyroid function on our body. Okay. And so stress will decrease the conversion of T4 to T3. So you can have symptoms of hypothyroidism like anxiety, nervousness, irritability. You can have weight loss. You could have shaky hands, muscle weakness, hot or cold sensitivity. Some of these are the stuff we talked about already, irregular heartbeat, changes in your bowel movements, trouble sleeping, and also fatigue. So I just think of so many women when I was working in primary care came to me and said, I think I have a thyroid problem. Can you test my thyroid? And we actually in primary care often do not check T3. And so this is getting missed, but it might not be that you need thyroid medication. It's maybe that your stress response and these cortisol levels are what really need to get regulated in order to fix the hypothyroidism symptoms. So that being said, I really would just, I put these podcasts out here because I want to help bring an education and understanding to women. So many women are just confused by all the information that's out there. They maybe go to the doctor, conventional medicine is not set up. We're not taught. Insurance doesn't reimburse us. It's such a complex issue of why women are underserved, in conventional medicine settings. But my hope with this podcast is that I'm bringing the information to you to help you, maybe understand a little bit better how your body works and what you need to do in order to feel like yourself again. I talk to so many women who tell me, I don't recognize my body anymore. I feel like I'm living in somebody else's body. And they go to the doctor and they tell the doctor about their symptoms. They maybe run a few labs and they say, everything is normal. This is a normal part of, you need to work less. You need to decrease your stress. You need to lose weight. You're just a mom. You're getting older, right? We get dismissed. We get told all these things that basically say, this is just your lot in life and you should just accept these symptoms that you're having. But it's not true. And you can really feel like yourself again. You can get your energy back. You can improve your digestive symptoms. You can sleep better. You can have stable mood. So in another episode, I'm going to talk about low cortisol. We're going to talk about how do we fix cortisol. But for now, if you're hearing this and you're like, I think this is, I want to find out more. How can I get help? What we'll do is put the link to book a connection call. It's just a quick connection call with myself or somebody from the team, just to hear about you, your symptoms, and just help you find what's your next best step. We may have some free resources we can send your way. Or of course it could be looking like, it could look like working with our team if you're ready for that next step. So, all right. I hope you love this episode. Tag me on Instagram. I'm at Lori Aikman. And I'd love to hear your thoughts. If you learned something new, if something really stuck out to you, take a screenshot, share it on social, and share this podcast with women who need to hear this message. All right. See you in the next episode.